Hello viewers, welcome once again to my YouTube channel, and in succession to the videos what I've been taking up in general medicine and obstetrics and gynecology. So today's video of the discussion is about the very important short question what can be asked is about leukorrhea. So the word itself is suggesting that leuc is referring to something white and oria means flow. So in the condition of leukorrhea, there is an excessive vaginal discharge. So this excessive vaginal discharge can be either physiological or it can be pathological. And when it comes to defining leukorrhea, so this leukorrhea can be defined as that it is an excessive vaginal discharge which can be either of white, greenish, or yellowish in color. So, this kind of a secretion can be there from the vagina of the female. And when we look at the site from where this whitish secretion is coming, so the site of leukorrhea can either originate from the vagina, the fallopian tubes, the cervix. Most common site for this leukorrheal secretion, it is from the cervix. So either vagina or the ovaries and the fallopian tubes, they can also the originate they can be the site for this leukorrheic secretions. All right. So what do we find is that this kind of a vaginal secretion, this excessive vaginal secretion, can be occur during pregnancy as well, and it may be considered normal. So it may be considered normal when the discharge is thin or watery, or it is having as such no odor. If it is having, it is relatively odorless. So in such a condition, this leukorrheic condition can be considered absolutely normal. Apart from this, the excess of vaginal secretion, what do we find is this excess of vaginal secretion, what is there, it is quite evident from the wetting of the undergarments, and there is consistent or persistent moistness of the vagina. So moistness of the vulval region is there, or the lady can be mostly in the habit of using a vulval pad. So this is the most common clinical finding what can be seen in a woman who is suffering from leukorrhea. Now when we look at the signs and symptoms of normal leukorrhea, so this leukorrheic secretions can be broadly subdivided into two categories. Either it can be of the physiological origin or it can be of the pathological origin. Now in the conditions of normal leukorrhea, what do we find is that there is non-purulent, non-offensive, and non-pruritic. And as such, it's this if it is a normal leukorrhea, it is having no odor. So it is never having any kind of an itching, neither it has any odor, and it is absolutely non-offensive. So in the if it is a normal leukorrheic condition, so as such the discharge what is found is it is thin and watery, and as such it is not going to have an offensive odor, or neither it will cause the itching or the pruritus in the vulval region. Now this physiological leukorrhea can be is due to the development of the estrogen levels. So excessive high estrogen levels, whenever in all the conditions of the body, when excessive levels of estrogens are present in the body, this may precipitate leukorrhea, particularly in at the times of puberty. When the puberty sets in, so that's the time when the estrogen level shoots up abruptly, it rises. In the conditions of pregnancy, apart from this, in the time at times of sexual excitement, or during the time of menstrual cycle. So these are the times when there is an excessive endogenous production of the estrogen hormone, that is the main cause for this leukorrheic secretions which are of the normal physiological origin. Also, what do we find is that these physiological leukorrhea, it may occur within months or years after the onset of the menses in young adolescent girls, that is when their menarche has started. So at that time also this leukorrheic secretions can begin either once or an year after the onset of their puberty, after the onset of their menstrual cycle, and it can be even sometimes be seen in a newborn girl, usually lasting for a period of 1 to 2 months. So this excessive secretion is basically attributed to the increased production of the endogenous estrogen hormone levels. However, in many cases, this leukotric secretion can be of a pathological origin. Or how to diagnose this, if whether it is a physiological or a pathological, just by visualizing the quality of the leukotric secretion. If it is thin, watery, colorless, and as such having no odor, no pruritus is there, no itching is there in the vulval region, so obviously it is a normal leukotric secretion. But in conditions of pathological leukorrhea, where this secretion is somewhat greenish or yellowish in color, if the discharge, the vaginal secretion is somewhat having this kind of a yellowish or greenish tinge or greenish color it is showing, so it is obvious, it is an obvious sign of certain kind of an infection what can occur in the cervix. So abnormal leukorrhea may be caused by certain infections such as yeast or candida or certain kinds of bacteria, many STDs. So there are many STDs what can be transmitted, which can transmit many bacteria and viruses into the vagina. And these viruses, the sexually transmitted diseases, they are the main sites through which these bacteria and virus gain access into the cervix of the vagina. So this mainly predispose for this leukotric secretions which are of pathological origin. And these pathologic, in the cases of abnormal leukorrhea where the secretion is greenish or yellowish in color, apart from this can have a foul odor, and there the women experiencing it may have pruritus or slight itching in the vulval region. So that is certainly for sure that it is due to certain kind of a pathological condition. Either it can be a yeast infection or a protozoal infection or a candidal fungal infection, it can be there. So the main cause is the STDs. Through STDs, certain bacteria and viruses, when they gain access into the birth canal, so this has been attributed to one of the very important causes, particularly in the sexually transmitted diseases of gonorrhea and chlamydia. So this has been very easily found. Or in the conditions where this is vaginite, in the conditions of vaginitis. So vaginitis, it is a condition where the inflammation of the vagina is occurring. And in the conditions of vaginitis, what do we find is either it can arise due to a fungal infection, that is candida albicans, or it can arise due to certain protozoal infections. So when we look at the treatment, that how to treat it, so at the treatment, when we look at the treatment, what we advise to the for the treatment is, if it is a normal physiological origin leukorrhea, as such it requires no treatment, it will resolve by itself, it is a self-limiting condition. But in conditions of a pathological leukorrhea, where the abnormal secretions is having certain kind of a foul odor with greenish and yellowish color of the discharge, so in such a situation, the most important treatment modality is that treatment of the underlying cause. So whatever is the underlying cause of the infection, that needs to be treated with the help of antimicrobial therapy or antifungal therapy. Apart from this, the process, the women should maintain proper hygiene, and they should keep the area, the private parts, clean. And one more important thing what I need to emphasize, that vaginal douching, there is a, particularly the women who are having the who are actually performing the vaginal douching, so that should be discouraged. The doctors mostly do not recommend about for the vaginal douching, because this vaginal douching becomes the very important cause for the disruption of the bacterial flora and the acidic environment in the vaginal canal. So if vaginal douching of woman is performing, she should stop, avoid doing it, because this can disrupt the microbial flora what is present in her vagina or the birth canal. So vaginal douching is not allowed. Proper maintenance, proper cleanliness is recommended for such women. Apart from, they can have a very good healthy diet, proper nutritious supplements they should have. And if they are consuming the oral contraceptive pills, what they are causing this increased levels of estrogen in the blood, so such women should stop taking oral contraceptive pills. Apart from this, for the treatment, they can go for the antimicrobial or the antifungal therapy, depending upon the underlying cause of the leukotric secretion. So viewers and students, this was a very short discussion where I've tried my level best to give you in simple terms what is the condition of leukorrhea, It can be either physiological or pathological. What are the types of it? How it can be either there in the pregnant or in the non-pregnant women, and if it is of a pathological origin, what all traits and how this can be managed. So one thing more I would like to emphasize, that if this condition of leukorrhea, if it is due to a sexually transmitted disease, or if the leuchoric secretion is of an abnormal texture, that is a foul smelling or yellowish or greenish, if this is not promptly treated at the right time, it may further lead to certain problems what can lead to such the conditions of pelvic inflammatory diseases. So it can further progress to pelvic inflammatory diseases, and which can later, in the later time, it can manifest as it can cause a problem of infertility as well. So this has to be very importantly kept in mind. So prompt treatment is required if the expecting if the lady who is suffering from this condition. So prompt treatment of such a situation needs to be carried out, so that the further progression of the infection should not take place, and later on the chances of pelvic inflammatory disease should be reduced manifold. So viewers and students, this was a very short discussion where I've tried my level best to give you in simple terms the what is leukorrhea, what are the types of leukorrhea, what are the causative organisms from where which sites this is originating, and the medical management of leukorrhea. If you still have any queries or comments, you're most welcome to comment me in the comment section. And viewers and students who are new to my channel, who haven't subscribed, subscribe, and don't forget to press the bell icon so that you can be further updated for my upcoming videos. If you like this video, give this video a thumbs up and do share amongst your friends. Thank you for watching.